So I just say I get points for jumping on that stage with heels on. Good evening, everyone. Bienvenue à Toronto. For those folks who are not from this great city, I want to first of all thank President Brzezinski for the introduction. I want to applaud Vanessa on her term of office over the past 2 years. She's done some great work, so thank you for that. I think we're going to be seeing each other actually next week for Take Your MPP to Work, so I'm looking forward to that. I also want to welcome your new president, and I understand that she was unable to be here tonight, and that's a difficult thing that she's dealing with, and I know that she will, however, be a fantastic addition in terms of the leadership of this organization. I want to take the moment just to congratulate Carol for her moving to the new role. You know, together with Dr. Grinspan, 20 years of that firebrand, your entire team has done some really great work. The RNAO is not only a strong and credible voice for the nursing profession, but you're also a leader in promoting healthy public policy in Ontario, and that is no surprise. Nursing is all about doing the right thing for people. It's about making lives better, helping patients in hospitals in their own home, and making sure we address the upstream causes that impact the health outcomes for all of us. In March, I was fortunate enough to spend a week up in Sioux Lookout in the region that's northwest of Thunder Bay, and I spoke to some of you a little earlier tonight about that experience. I got to sit and talk with the registered nurses who are providing care for diabetic patients in one of the most under-resourced areas, not only of this province, but of this country. I can only imagine how difficult their days are, but they are nurses. And despite all of the existing barriers to care, they have devoted their careers, all of their energy, every last ounce of themselves to taking the hand of their patients and helping them through the most vulnerable moments of their lives, because that's what nurses do. You are members of an extraordinary profession built on expertise, dedication, and compassion. And this evening, on behalf of Ontario's New Democrats, I want to thank every registered nurse, nurse practitioner, and nursing student in the room tonight for the work that you do to help Ontario patients. You do inspiring work based on an inspiring vision of building a healthier, more inclusive, and much more equitable future in Ontario. A future where we expand our proudly universal, public, not-for-profit healthcare to include pharmacare and home care. A future where we reduce disparities and reduce inequality. And a future where what's best for people is always the bottom line. Cette vision pour un milieu à venir, nous la partageons. But to do your work to the full scope, it's absolutely critical that the work of nurses be supported by the decisions made at Queen's Park. RNAO put it best when you said earlier this year that public policy is a major influence on health, and public policy is largely determined by budgets. I couldn't agree more. And that's why yesterday I launched the NDP's call to restore stable, predictable funding to Ontario's hospitals and ensure that at the very least, hospital funding keeps up with inflation and population growth. That should be the minimum standard to protect patient care. 4 straight years of frozen hospital budgets have forced Ontario's hospitals to lay off hundreds and hundreds of nurses, and that's a problem, because there's no way we can transform the healthcare system and actually improve care for patients by cutting the very nurses that provide the care. And so what we need to do is protect our hospitals at the same time as we work to meet the changing needs of Ontarians, and at the same time as we take much stronger steps to improve the social determinants of health in Ontario. You can help a patient recover. You all do it very, very well every day. But if that patient is going back to housing that isn't fit to live in, or going back to 3 part-time jobs, none of which come with benefits or security or decent wages to actually pay the bills, or going back to a life in the midst of systemic poverty and systemic discrimination, we know what the prognosis really is. Health inequities will continue to grow if we do not take stronger action to address the social determinants of health. Nous devons en faire plus. We can't just talk. We need strong action. Like following the lead of Premier Notley and cities south of the border and raising Ontario's minimum wage to $15 an hour. Because decent pay for a decent day's work or for a hard day's work is never too much to ask for. A $15 minimum wage is just one step towards building a healthier society, and it's a step we need to take to help achieve this vision that we share. The vision of a healthier, more inclusive, and much, much more equitable province. In Ontario, we can make that vision a reality. There is no doubt in my mind that that vision can become reality. And I need you to know, I want you to know, that you can count on New Democrats to work with you to make it happen. I want to acknowledge the comments that have been made both by the Minister and by the Leader of the Official Opposition around some of the work that is ongoing, some of the things that were announced today, which are interesting and quite exciting and hopefully not going to sit on the cooker for too long, actually get implemented quickly, but also the concerns that we have, and they were raised by the Leader of the Opposition. New Democrats brought the amendment to the committee that was reviewing the PTSD legislation, and we were extremely disappointed in the decision by the majority government members of that committee to not accept that amendment. These are the kinds of things that we don't need to study. These are the kinds of things that we know already are a problem in the nursing profession. We know what kind of difficulties nurses face day in and day out in their job. We know what kind of workplaces many nurses, most nurses, face each and every day. The amount of accidents, the slip and falls, the kinds of physical demands that your jobs have that lead to injuries and illnesses that are significant. It's shocking to see the statistics around nurses and their health and safety. PTSD is legislation that responds to one piece of the kind of environment that you face in your work that can make you unhealthy and unwell. And it was a lost opportunity, to say the least, that that amendment was not accepted and that we now at some point have to have new legislation or have to have some kind of amendment made in the legislature to right that wrong. But we will be pushing with you and for you to make sure that that happens. And so I just want to end by saying thank you so much for your dedication. I've had the privilege and the honor of addressing the AGM many times. I look forward to doing that again in the future. But I do want to say on behalf of New Democrats, I want to wish you all a very inspiring and productive 91st Annual General Meeting. Thank you all for all of the great work that you do. Merci, Megwitch. Thank you very much. Unfortunately, I'm going to have to leave right away, but I do want to say from the bottom of my heart, there's a reason why nursing is the most loved profession in the province of Ontario, and I'm looking out at it right now. Thank you so much.